Residents of Murphysboro, good afternoon. It's April 23rd. It's been about a week since we had our last briefing. There's been all kinds of things that have changed and come up. So I wanted to take the time tonight to really go over some of the things that we've been working on, some of the things the city's been working on, the state's been working on, and our country's been working on. Today, it was announced that in the state of Tennessee, we have total confirmed cases of 8,266. I have a graph here for you to look at. We're up 424 cases. We have total confirmed fatalities of 170, total hospitalizations of 793, and recovered 4,193. So that's a great number. If you also look at available medical inventory, that's a number that we look at on a daily basis, that we have 33% of our hospital beds are used right now, 32% of our ICU beds are used right now, and 75% of our ventilators are used right now. Also, we go over this, the PPE, our resource overview that we have brought in not only into our county. Our city has had an inordinate amount of PPE equipment. All of our emergency service providers are staffed right now. Chris Clark has done a phenomenal job, along with Mayor Ketcher and all the local municipal mayors. We appreciate their work. Chief Folks and Chief Bowen, specifically here in the city of Murphysboro, have done a phenomenal job. I was able to get with some gentlemen day before yesterday and actually had Jack Daniel's hand sanitizer that came from the Jack Daniel's distillery, that as we ate breakfast, that we were using the hand sanitizer. Something that I think you're probably more concerned about in Rutherford County, the total cases today, we had 351 cases versus 345 yesterday, so we had an increase of 6. That also includes 7 total fatalities. Our total hospital beds, and we have a graph up right now that really want to go over and sort of talk about. Steve, I'll tell you what, we'll go over this graph here in a little bit as we get into some of the other things we've been working on. We have 2 total fatalities that we've had. Our total hospital beds, we have 80 available at St. Thomas, 82 at Stonecrest, and there are 14 patients in St. Thomas right now. None are on ventilators, which is a blessing. So I think we're seeing as a community that our emergency service providers, our healthcare workers, our hospitals, our clinics have done a phenomenal job. And as residents, you've done a phenomenal job on either being safe at home or staying at home. So we greatly appreciate what you're doing there. Let me click on this. I'm missing comments here. So, yeah, and you have to hit someone was asking, you have to hit the live button for our briefing to come up on there. So, also, all right, let's move into what we've been doing as a city. In the city, it was announced yesterday, Murphysboro City Schools will not be doing the ESP program for right now. We didn't feel like that was probably a good thing for us to be doing right now with all that's going on and putting kids in a confined space together. We're going to do everything we can to get that back and running later on in the summer. But right now, support Dr. Gilbert, the school board, in that decision. The Chow bus is still going on, so our feeding schedule is still going on. They've done a phenomenal job on making sure that is going on. Parks and Recreation. Our Parks and Recreation, there's not really been anything that's changed. If y'all give me a second here, I want to get this up so I can make sure. We're having a little issue with our feed. So give me 1 second to get this up and going here. All right, we'll wait. Hopefully this will refresh here in a little bit, and I can, if there's any comments, I can see those. But our Parks and Recreation Department has still worked on the exact same thing that we've been going off of. Our indoor facilities are closed, outdoor facilities are closed. basically the fields are open. We're still monitoring the social distancing that's going on with those facilities. We have a 3-phase plan that we have in place right now for our Parks and Recreation Department that we're working on. Current status, basically everything is closed, but we'll get into it here in a few minutes. But it's broken down into 3 phases where we'll go to some limited openings and some different things that will be available for you, and that's for SportsCom Patterson, the Adams Tennis Complex, McFadden, St. Clair, Bradley, Canonsburg, the Wilderness Station, all of our sports complexes, all of our playgrounds, pavilions, outdoor public restrooms, and our dog parks. So those are things that we will get with you here in just a little bit as we get into more what we're doing as a community. Today, Governor Lee announced that at 3 o'clock that he will be providing guidance tomorrow morning at a special press briefing to share the first round of industry guidance that he's releasing. Starting Monday, he did announce today that April 27th, restaurants will be able to open if they operate at 50% capacity and follow guidelines that will be released tomorrow. So we don't know what those guidelines are yet, but we'll get those tomorrow. Also, starting Wednesday the 29th, retail locations will be able to open if they operate at 50% capacity and follow the guidelines that will be released tomorrow. Governor Lee announced the Safer at Home order will expire on the 30th, allowing businesses to reopen on May the 1st. Now, I want to make sure, and we'll get into this in a little bit, I don't think that that's going to mean wide open on May the 1st, but there's going to be some stipulations with that, and we can go over what the city of Murphysboro is doing. He said the Economic Recovery Group is working with industry leaders so that some businesses can open as early as Monday the 27th, and if you can see his website for more details. Now, where that goes to the city, one thing I do want to hit on, we have been working, and it's the timing of the virus coming. This is normally when we would be working on our budgeting sessions inside the city. During this time, normally the city manager is meeting with individual council members. We're meeting and we're going over our priorities for the next year. We're going over revenue projections, expenditure projections, and how we maintain the level of services that we have within the city. We have made the decision, and Mr. Tyndall has talked to all the council members, but we will not be doing any new borrowing in 2020. We're going to make a determination in 2021 on what we're going to do with projects and borrowing there. We just really felt like that the fiscally conservative thing to do is to see in 6 months where this is going to play out. Something that is a little different with the government as opposed to, say, our individual businesses. At the end of every month, we know where our business is right then and there. The city government and a lot of municipalities and county government, we don't work that way. We just got last week our February numbers, so we normally run 45 to 60 days behind to see where our sales tax revenues, hotel motel tax revenues, your beer and liquor by the drink revenue. So we've got some significant decisions to be able to make. And personally, I felt like, and I think the council agreed with this, that we really need to see what's going to happen over the next 6 months before we start making long-term decisions that we just don't know yet on where we're going to be. Moving on, going into our plan, I got together late last week, early this week. We've already been working on, I think it's prudent to talk about. We know that we've had to shut things down inside the city. So, my next thing that immediately we talked about was, okay, at some point we know we're going to reopen up, but let's put a plan in place to make sure that we do everything that we can to work with our residents and to work with our businesses. Now, the thing that's different with us than you'll see in releases that the governor has put out, that he'll name specifically 6 municipalities or 6 counties that he's working with. You've heard me say this, there's 6 metro health departments inside the state of Tennessee. Those metro health departments do not necessarily answer to state guidance. They can make their own guidance on what they're going to do. Now, I'm not saying that they don't cooperate with the state, but we're one of 89 other counties in the state that we directly answer to the guidance that the state puts out. So we've, even just this afternoon, we've had our plan in place that we've been working on, but as the governor makes announcements, we get those announcements when you get those announcements, so we have to move on the fly and we have to adjust our plan. So, I was fully prepared to be able today and tomorrow to release what we're going to do, but we really need to see what the governor is going to mandate to us or for his guidance to be able to tell the municipalities in those other 89 counties exactly what we're going to do. I'll give you the high points of what we've really been looking at. I thought it was really important to break the city down into different segments, and that's what we did. We broke down segments into, for example, employers and individuals, retail, restaurants, office, manufacturing, warehousing, medical, healthcare, hair and nail salons, tanning salons, body art studios, gyms, parks, ball leagues, sporting venues. So we broke the city down into all these different movie theaters, banks, bars, schools, and organized youth activities. So we broke the city down into these different categories. I think the thing that was very important was for us to be able to not just as a government say, this is what we think we should do. So what I asked staff to do, and I want to tell you, our staff has been phenomenal. Not just our entire staff, but especially I never want to leave these men and women out. City TV has done a phenomenal. They've just done a great job. I keep saying phenomenal because our entire team is that way. We got a shout out last week from the state on how you should be handling things with city schools, on how our City TV3 has been handling things as a city school. I don't know how other municipalities handle their media, but if they do things like our City TV3 does, then the world's a better place, because we could not be getting the information that we need to get out without these men and women. So they're part of this team that has been doing this, and WGNS is also broadcasting this tonight, so we appreciate y'all doing that. But what we ended up doing, much like media, I couldn't tell you how to produce a show, but I don't know what's the best thing for restaurants to do. I don't know what's the best thing for gyms to do. We have ideas, but what we did as a staff is we reached out to stakeholders and industry leaders inside our community to get their input on how things should be handled in their businesses. So someone that I will tell you that was great and sent back a lot of information, Steve, if you'll put up the picture of the seats in restaurants. We got information back. Wade Hayes at Toots sent us some great information to show, hey, here's some recommendations that we would like to see in our, for instance, our bar areas or in our table areas. So Wade sent us back, here's how we're going to handle and what we feel like would make sense, because we can say a 50% occupancy, but if people sit in the only 50% that's open, we have to make sure that there's smart ways that people can handle those. And who best to get that information from than to get it from our small businesses and our businesses here in Murphysboro. So that's what we've done. We've put together a 3-phase program in conjunction with President Trump's program, where he has put in place the Opening Up America Again. And there's a lot of good information that we've been able to get from the president's plan that gives us 3 different phases that we can go off of. And so we looked through his plan and didn't really feel like that there's any reason for us to reinvent the wheel. So we've taken his plan and then we've modified that to be able to put that into how the city of Murphysboro is going to operate. So, a good example, and I don't want to go through each one of these, but, in retail, something that I think is very important is we went through and had a great conversation with Judy Goldie with Trendy Pieces in the marketplace on the square that, Judy was saying, hey, Shane, we run a boutique. Same thing with Elizabeth Allen, with E. Allen. They're 2 of the people that we coordinated with, but they just don't have a lot of people in their store at one time, and they're easily able to social distance. So things that we were able to put into place, and we have is a temperature check of employees prior to the shift work, so that way we make sure that the employees are safe. Allowance for time off for reporting illness, a limitation of customers sufficient to allow for social distancing, hand sanitizers for employees and customers when exchanging payment. We're asking to avoid cash. regular access to and mandated staff use of wash stations, and use of masks. So there's all these things that we've put into place that we feel like that we should be able to help with. But I want you to know that a lot of this just didn't come from us. This is coming from your fellow business owners and people that you shop with in the city of Murphysboro that think that this is the best way that we can handle things. So we're going to handle this in phases. 3 phases that are going to be based upon President Trump's guidelines. And Steve, if you'll bring our percentage up. So this is the thing that you have to see that's very important. You do have to take into account that there's 351 positive tests in our county. We have, based on 2018 census data, we've got 340 some odd thousand people that are in our county. So we're still rough numbers at 0.01% of positive tests in our county. Now, this also includes the testing center that will happen this weekend. I can't go into what the exact numbers were, but I want to tell you we had over 400 some odd people that went through the Burton Street at the health department, and the percentage was extremely, extremely low of people who tested positive. So, and we think that's probably going to be more of a reflection that's in our community. But if you look at right above the chartreuse line, if you'll look at the line, Steve, there at the end, if you look at the end where you look at 22nd, 23rd, 24th, 25th, you'll start seeing that Rutherford County is trending down. You'll see a spike that we had in the 20th, but you'll also see 18th and 19th. I think we only had two positive tests that were there that we had, and then you've seen some up and downs. But what you're going to see, and what we really feel like what you saw this weekend, is with now that the testing has been ramped up to where you don't have to be symptomatic to be tested. Clearly, when you look at the very front, when you're in April 1st and April 2nd, go into the data that we had put in place. Let me go to my chart here. For example, in just say April 1st, in Murphysboro, in Rutherford County, we had 68 tests and we had 11 tests positive. But as you started getting into early April, mid-April, and now late April, you'll see that the testing numbers have gone up almost every single day. So today, the 23rd, we had 351 total tests and 6 positive, so that's 1.7%. Since April 15th, we've had 0.7%, 0.7%, 8.9%, 2.4, 2.3, 6.1, 3.0%, 2.1, and 1.7. So except for a few outliers, you're seeing that the social distancing and the things that the president, that the governor, and that as local municipalities that we've put in place, that the numbers are continuing to level off and to go down. Now, what's important, it is important to look at the percentage of tests into relation to positives, not how many tested positive, because the more that we test, the more that the numbers are going to go up. If you test 1,000 just in percentages and say that 1% are testing positive, then you've got 10 that are going to test positive. So those are the numbers that we're looking at. It's important that we make sure that when you're looking at these numbers, you want to make sure it's not just how many tested positive, it's how many tested positive into relation how many were tested that day. And that's the number that we're going off of. In the president's plan, it's 14 days of showing a declining scale, or the trend of a declining scale. And then from there, it goes into different categories on, has there been an outbreak? Has there been a spike? And that goes also into the CDC guidelines that we have. The CDC guidelines, they classify as the community mitigation strategies. One of the number one things is individual responsibility, and we'll get in that in a second. But the level of community transmission or impact, it's in 3 different categories: minimal, moderate, and substantial. And minimal is evidence of isolated cases or limited community transmission, case investigation underway, no evidence of exposure in large communal settings, healthcare facilities, schools, mass gatherings. And right now, we're classified in the minimal stage. Now, as we go through each one of those, that's where our plan and our three-phase plan of how we're going to implement and get Murphysboro back to work again is going to come into place. And I hope that what we'll end up doing, getting the governor's guidance tomorrow, that we'll be able to release. This is exactly what we need to do. I want to be very clear. We have got to get in a safe and a reasonable way the people back to working in Murphysboro. We're now going on almost 5 weeks since March 21st is when we put our order in place. So we're 4 weeks and some change, and I don't want to take anything that we've done. I think the residents of Murphysboro have done a great job. Our churches have done a great job. I mean, the amount of people who are watching church online now is absolutely incredible. So, there's some things when I say we want to go back to normal that I don't want to go back to normal, but we've got to continue those things to keep the downward trend in place. And a lot of that's going to have to do with our Parks and Recreation Department because, kids are wanting to get back to playing baseball. And I want you to know that our number one priority is to make sure that we keep our residents safe. And we're going to work with our county mayor. We're going to work with our local municipal mayors. We're going to work with the state, and we're going to work with the federal government to make sure we're going to do that. Before I get into questions, I try to keep these to 30 minutes. I want y'all to know I'm a glass half full guy. I try to look on the bright side of every picture, but I want you to know this is not over. I think that we have done a good job to this point, and I'm not up here giving you a rah-rah, this is all going to be over. I do think where we are right now, it's been minimal. Our hospitals have not been overwhelmed. Our infrastructure, our healthcare providers have not been overwhelmed. We're still putting into place our child care plan. That's an issue that we've got right now with ESP not coming back, that we're trying to make sure that we partner with who we need to partner with to provide child care for our healthcare workers. But I don't want anyone who's watching this to think that I'm telling you that, come May 1st, that the switch is going to be flipped and everything's going to be back normal. It is not going to be back normal. And I'm not telling you that to scare you. I just think it's reasonable to be able to say that, in a week from tomorrow, the likelihood of being able to flip a switch on and everything going back the way it was is just not possible. One, there's some things in place, and I don't want to get on my soapbox with the federal government, but, our restaurants have got to be able to have time to staff up. The governor announcing today that restaurants can open on Monday. We've got to have the ability for these restaurants to be able to get food, and there's things that the city's going to do everything we can to help with. I want to equate it to this way, and had a great conversation with Representative Terry today. Brian went through and was talking about how that he's advocating for state and regional hospital capacity warning systems that would help guide us moving forward. So we're just not looking at how many people are testing positive, because the majority of the people that are testing positive are recovering, but really what we have to look at is what this is doing to our healthcare system. But I want to equate this to a red light. We've been in red, and we've recently allowed you to be able to turn right on red. But now we're going to go to caution. We're going to go to yellow. But, y'all know people in Murphysboro like to run red lights, and we have got to be cautious. So if you're in the protected group of the elderly, or you've got other underlying issues, if you're immunocompromised, you need to stay at home. And there's not anything that I'm going to be able to do with anyone around you to help you with that. You're going to need to stay at home if you're in that group that needs to be protected. There's not any policies we can put in place to protect anyone that is symptomatic or that has underlying issues. So please, for your safety, stay at home. And if there's ways that we can help you, we want to help. But before we can get to green, we've got to get through the yellow portion. And what I don't want to see us to do is go back to the red because we're not being smart. Now, at the same time, we can't go about our community and live in fear. We just cannot do that. So, but we can be smart. So remember the analogy on the red light. I wrote this down. I think we have two distinct things that, as business owners, and I'm one of those, that we have to be able to look at and I know I'm preaching to the choir, but as we open back up, it is imperative on our business owners to understand that your customers' lives are going to be in your hands. So the decisions that you make on how clean that you keep your shop, on how clean that you keep your restaurant, on how clean you keep your store is going to be beneficial to what happens in our community. So if you think that these standards that the CDC is recommending or guidelines that the governor or as a mayor that we're recommending, please help us with that. We need your help. Your reputation is on the line. I mean, if you've got a business that has an outbreak and high tests of people coming in and getting COVID, that's going to hurt your business. So do everything you can to help with these guidelines. To our residents, the number one thing that we have is personal responsibility. We have to be smart. We're not through this yet. Social distancing is going to be in place. I was listening to President Trump last night talking about things that are opening in Georgia and in different ways that we need to be able to social distance. So as a resident, we have to have personal responsibilities. If a business is not adhering to the policies and you go into a business and you see that they're not doing things the right way, take your business somewhere else. Reward those that are being smart, that are doing things to protect you and to protect the community. So to sum up, I want to say that, we've had the stay-at-home in place, the safer-at-home in place. My order that I have to renew my order every 7 days. I am not anticipating renewing our order on the 28th. I want to say something too. We put our order in place because the governor, clearly I could have not renewed our order, but our order that we put in place had some things that helped small businesses in Murphysboro, and that's why we did that. It wasn't to add more restrictions. It was actually to lessen restrictions inside the city, and that's one thing I'm super excited about, to be able to tell our staff that, we've been able to make it with suspending some of these ordinances that we've had in place for I don't know how long, but we're not going to bring those ordinances back, or if it's up to me, we're going to present to the city council to not reenact some of these ordinances that we've had in place. I mean, we've been able to make it for 4 weeks or 5 weeks without having some of these guidelines in place or ordinances in place. So I don't see why we should re-implement them as we go through. So, all right, I want to take some questions, and then I've got one thing left. So let me go back, and I'm going to do my best to look at all these questions. Nashville has a number of bullets in their plan. I haven't gone. I've got Nashville's plan sitting here. I've been reading over so much information today, but our plan is I think a little more concise and easier to follow. But it's probably because it's ours, and I think it's a good plan. But we've got very detailed bullets on each individual thing, and so I'll look at Nashville's. Let's see. What about the people who didn't get tested or had it before the testing was easily accessible? Actually, I think I read an article today about the antibody tests that were in New York, and I can't remember the percentage. I want to say it was like 23% of the people that are tested were shown that they've already had COVID. So if you put that in terms of New York, I think the number was like 16 million people, or I forget what the number was. So, I continue to listening on the way here. I was listening to a doctor who was talking about what they're doing in Louisville. So I think there's some things that are gonna come back. Let's see. I'm scrolling down here. Hopefully beauty salons, nail salons, and barbers don't open yet. Too much close contact. That's something that we're working on. Let's see. I think that the other thing, though, is, realistically, folks, and again, I'm a glass half full guy. I go to the grocery store, and I'm walking right next to people, no matter how hard you Nick, how are you going to feel when people start dying just because we were impatient? I don't think we've been impatient. I think we've been the exact opposite of impatient. We've had the city basically shut down since the 21st, and I don't think there's any staff member or anyone in the city or county, for that matter, when I work with the men and women every day who are being impatient. I think residents are getting impatient because residents have been at home for 5 weeks now and they want to get back to work. So I think trying to find out how we reasonably can do that, and then putting that in perspective to where we are as an entire community, I think is important to look at that as well. How are high-risk people supposed to get groceries and prescriptions if they're surrounded by everyone else without required masking? And I think that's a great question. I think there are several different people that are out there that we actually talked about ways to get prescriptions to people that are high risk, and also with groceries being delivered. So I want you to know that's something that we're also working on as well. All right. How well are we conducting contact tracing? Brad, I think that's something that the health department is doing a really good job on, being able, as someone's tested positive, Dana and her team are being able to go back and find that contact tracing. Fields are open. Can you provide status on baseball practices and leagues, please? We don't know yet, Trevor, on leagues and baseball practice. When I say fields are open, I mean literally, I mean fields are open, not baseball fields. I mean, you can go, play in a field at some of the complexes, but we are just not sure. Like, I read an article today on what Little League is recommending, and so we're going to have to go through and find out how to be able to do that. Okay, I'm going to scroll down to the bottom here. Mask requirements. So there's going to be some things that we're absolutely recommending required masks. So that's a good question, Lisa. Lori Hastings, barbershop salons. That's something we're working on right now. We need to see the briefing from the governor tomorrow. That's the thing again. The civics lesson. I'm not trying to give a civics lesson, but I guess I am. But we all answer to someone, and we answer to the guidance that comes from us from the state. So we're sort of shifting on the fly on that comes open. And I mean, hey, there's no one in this city who wants the salons to open quicker than I do. I mean, I'm getting a mullet, so I would be perfectly happy to be able to get these opened back up. All right, let me sneak over to here and check this one. Tina, when will we have a clear layout of which segment or phase professions will open? We have that. Like I said earlier, we want to be able to see what the governor comes back to us on that guidance. Scroll back through here. Let's see. I never thought that there would be a day that I could sit up here and answer instantaneous questions. So I think even when this is over with, that this is something that we'll continue to do. Let's see. What about churches? Will there be a maximum number of congregants allowed with a certain space? Right now, Barry, there's absolutely nothing wrong with a mullet. If this goes on any longer, I definitely have more hair in the back than the front. Pastor Windrow, and I'm glad you're feeling better. There's going to end up being guidelines on social distancing and gathering more than 10. Now, right now, churches are listed as essential, which I think we've got to figure out how to do that, because we don't want churches to have outbreaks. But those are some things that we worked with yesterday on, coming up with a couple of different things that we do have in our plan here. Okay, I want to leave it at this. I've learned, and sometimes you get emotional, or when I say emotional, you go through a phase where you get upset, you get mad. I want to make sure that people know, it was not in any of our plan to be sitting here talking about businesses that are being closed down. It's just not something in anyone's imagination that we would ever want. But I've learned that there's three types of people in this so far in this whole process, or this whole COVID deal. You know, you've got the one group over here that says that you're doing too much, that you're being tyrannical, that, you know, this is the government wanting to take my rights away and trample on the Bill of Rights, and you know, that we wanted to do this, which I can assure you that's not the case from my standpoint. I can't speak for anyone else but Shane McFarland, and the last thing that I ever wanted to be able to do is talk about people who are sitting at home and not able to go to work. I have a wife who's not been able to go to work in 5 weeks, and she wants to get back to work too. Then there's another group that, you know, wants the government to enact as strict policies as we possibly can, that we all stay at home, that we mandate everything, and then that's what the government should do. And then I like to think that there's a large group that you want us to be rational. You want us to make educated decisions based off people who are giving us lots of information, and that, you know, you want us to be able to make the best decision that's out there, not a political decision. And it's the thing that I want you to know, and I want to promise to you, any person that sits up here and is making decisions on whether they're going to get elected again or not is not going to make the best decision for their community. And I'm proud to tell you that the people that I've been working with every single day, the elected officials that I've been working with, I don't see decisions that are being made on trying to get reelected. We're making decisions, or I'm making decisions from our staff on what's best for our community, and what's absolutely best for our children in this community, our families in this community, and what's best for people to be safe. That's it. So I don't want to be able to do too much, and I don't want to be able to do too little. We're going to do everything we can to continue to keep Murphysboro safe, to be able to get Murphysboro moving again. We're going to follow the president's plan. We're going to follow our plan that we're putting in place. And I promise you, as I've told you at the end of every one of these, we're going to get through this. Now, there's going to be some painful times that we're all as a city going to have to deal with over the next 6 months to a year. I mean, who knows how long that we're going to be dealing with these. I think the ramifications that's come from COVID are going to be something that's going to follow us for years to come. But we've done it before, and we'll do it again. But when I talk about the three groups, and maybe I'm naive, you've got this group over here, you got this group over here, and you got this other group. There's no other time in the history of our community that we need to be unified and that we need to come together. We can go back to arguing about stuff whenever we get our community safe, whenever we get our community healthy, and whenever we get our community back to work. Those are things that we need to do. So let's all work together. Let's be unified, and let's get this thing done. Thank you for what you're doing out there. Thank you for what you're going to continue to do. I appreciate your prayers. I appreciate the kind support that you've sent. And most of all, I appreciate your trust. Thank you. We're going to get through this. God bless.